Good morning. Welcome, Dr. Meryl Alappattu. She is a research assistant with the Department of Physical Therapy with the University of Florida, and she has agreed to speak about urinary incontinence and physical therapy in honor of Fix a Leak Week. Hi, Meryl.
Hi, Liz. Happy to be here.
Glad you're here. So tell us, what is incontinence?
So urinary incontinence, quite simply, is defined as any involuntary leakage of urine. So if you didn't mean to urinate on yourself and you did, that would be urinary incontinence.
Okay. And what are the different types of incontinence?
So three of the most common types are stress incontinence, urge incontinence, and mixed incontinence. So stress incontinence is any leakage of urine that occurs with coughing, sneezing, laughing, jumping, any activities that increase your intra-abdominal pressure. Urge incontinence is leakage that's associated with a feeling of urgency. So what exactly is urgency? Urinary urgency is that all of a sudden feeling that you get that you've got to get to the restroom and you've got to get there pretty quickly. Otherwise, you are going to leak. And then finally, mixed incontinence is when you have symptoms of both stress incontinence and urge incontinence.
Oh, so is incontinence just a natural part of aging or working out or sneezing?
You know, I think that's a great question, Liz, and I think that's somewhat of a misconception, especially when it comes to women. Women tend to think that as they age, that they should expect to have some issues with leakage, and quite frankly, because something is common, and it is common in older women, doesn't make it normal or doesn't make it a natural part of aging. And so there are strategies and treatments that can help manage incontinence, especially for people that experience it as they get older. It's not something that older individuals should feel that they are now, left with a life where they have to wear pads or diapers or they can't leave the home. So again, just because it's common doesn't make it normal, doesn't make it natural.
And is it just women that suffer from incontinence?
So it's not just women. Men also suffer from incontinence. Children can suffer from incontinence as well. Anyone that's had any type of surgery or trauma to the pelvic area can also suffer from incontinence as well. So it's most commonly reported in and talked about, I think, in society anyways, with women, but it definitely is something that's not just limited to women.
And what can be done to treat it?
So there are lots of different, there are different treatments that physical therapists can do to treat incontinence. So if you see a physical therapist that specializes in pelvic rehabilitation, including the management of urinary incontinence, that physical therapist is going to find out, number one, what are the symptoms that you personally are having related to incontinence. They're going to assess your pelvic floor muscle strength and how your pelvic floor muscles coordinate and interact with the surrounding musculature. They're also going to find out what types of foods you're eating and what types of drinks that you're putting into your body as well. I think there is a little bit of a misconception that all physical therapists do for people that have incontinence is pelvic floor muscle exercises or Kegel exercises, when in fact there's a lot more to what a physical therapist does out beyond just pelvic floor exercises. So if you are a patient where your pelvic floor muscles are tight or you have a difficult time relaxing, your physical therapist probably isn't going to focus on Kegels with you. He or she is going to teach you how to relax your pelvic floor muscles. There's really no one-size-fits-all approach to the management of incontinence. And so once you undergo your examination and evaluation by a physical therapist, you'll receive a personalized treatment plan based on your specific issues that the physical therapist is going to address with you.
So can't I just go to any physical therapist to get treated, or is there a special certification?
So there are special certifications available. There are also trainings that physical therapists receive beyond their entry-level doctor of physical therapy training. So you don't necessarily have to receive a certificate or a specialty after receiving this training. But if you're a patient that is seeking care from a physical therapist for incontinence, I think it's a fair question to say, what additional training do you have in managing a condition like incontinence? Vast majority of physical therapists don't receive enough training in their entry-level programs to graduate and be able to manage a patient with incontinence straight out of school. There is additional specialty training that should occur.
Oh, that's good to know. And where can I find a physical therapist?
So you can find a physical therapist. The American Physical Therapy Association section on women's health has a PT locator online. And so you can go to Google and type in SOWH PT locator, and it'll take you to the online tool where you can enter the city and state that you live in, or your zip code, and find a physical therapist who specializes in incontinence in your geographical area. It's a great tool.
Great. And we will provide that information at the end of this video. And Meryl, thank you so much for your time. We really appreciate it.
You're welcome. Thank you for having me. I appreciate it.
Absolutely. And in honor of Fix a Leak Week, this has been Dr. Meryl Alappattu talking about incontinence and physical therapy.
Thanks, Liz.